we use these webinars as an opportunity to educate folks on everything that's going on in Miami-Dade County, whether it's our departments or services. And in the month of April, we're doing a special series specifically about autism and neurodiversity, and in this case, neuroinclusion. So for those of you who haven't seen it on social media, I launched a Florida Neuro Inclusion Toolkit. It's also a website, which we'll be sharing the link with you on this email and also on this chat so that you can visit it. And my partner in doing all of this work has been Michael Alessandri. So I want you all to hear directly from him how we've done this work. And I will say that I'm forever grateful to Michael Alessandri, not only because he runs an amazing organization, which is UM-NSU CARD, and really does such wonderful transformative work. So as a policymaker, I love him. But as a parent too, I could not have survived the spectrum, let alone thrived on the spectrum without his support and the support of UM-NSU CARD. So with that, Michael Alessandri.
Thank you, Commissioner. It's a pleasure to be here. And as I always say, you're our muse here at CARD. You inspire so many good things in this community, and so many of the wonderful things that we've been a part of have been really part of your broader vision to make South Florida, particularly Miami-Dade County, more neuro-inclusive for children, adolescents, adults, but more importantly for the whole family. And we want to make sure the work we've been doing is really all about creating, I always say, creating places and spaces that understand our loved ones with autism and related disabilities, because our families do feel isolated a lot of the times. And if we can create a community with all those supportive concentric circles around the person with autism, then we have done, as they say, God's work.
Yes.
We have a lot of work to do, and CARD has been a proud partner. For those who don't know, just briefly, I'll say that CARD is a state of Florida Department of Education discretionary project, and our mission is to support our local communities and our school systems, public, private, and charter, as much as possible in a variety of different ways. But one of those ways is through public education and awareness. So we have been proud to partner with Commissioner Regalado on a major initiative approved by the presented by her, approved by the county of the board of county commissioners, and supported by the mayor. And we've been doing this work for the last 5 years, and it's allowed us to partner with parks, libraries, first responders. We have trained over 4,000 first responders. We have 50 autism-friendly libraries. We have worked extensively with the Parks and Recreation, and we'll be doing some wonderful presentations this weekend at the Autism Bike Ride. And we've also worked with emergency management, a lot of our local venues like art centers and museums and urgent care facilities. So we have really laid the foundation for, I think, something that is not only special for our community, but that's a model for every community. So I'll pass it to you, and then I'll continue to contribute throughout the session.
Fantastic. So we're gonna go through it, and like Michael said, we've really done a lot of work throughout different spaces, and that's what the toolkit is about. And I think, Michael, you agree. We talk to a lot of elected officials and a lot of parents that reach out to elected officials, and I think people want to do this work. They just may be overwhelmed as to where to start. So what we're going to explain today is what the toolkit offers. And a lot of the work that Michael mentioned that we'll be talking about is in the toolkit. So the appendix actually has the libraries, there are 50 social stories, the legislation that begets some of this work so that folks can copy that legislation. If you take one thing away from this webinar, it's that you don't need a consultant. This is not something that's super crazy hard to do. We've proven these pilots, right? And what we want is for folks to replicate it. And Michael and I have really gone out of our way to make this as replicatable as possible. So in a time, we started this work in 2020. When everybody was like creating things, we actually didn't create things. We stayed within existing systems because we wanted to have longevity, right? We want people at all different scales, in all different sizes of communities to do it. I don't want this to be an urban thing or a suburban thing. I think it can be done everywhere. And that's really what the toolkit is about, is really taking these programs and taking them to all these different communities and doing them. So with that, Alejandro, if you could start the slides. Awesome. So, Michael, you talked a little bit about what UM-NSU CARD is. I made this broader about neurodiversity. So just to broadly explain neurodiversity, obviously neurodiversity includes folks that are in the autism spectrum, but it also includes people who have ADHD, traumatic brain injury, dyslexia, a lot of different things. And in terms of neurological decline, one of the things that I've talked to our municipalities about is that some of this work also helps people who have been diagnosed with dementia or Alzheimer's. So there's also that group of folks. So when we look at what is neurodiversity, we're talking about 1 in 5, not taking into account dementia and Alzheimer's. So next slide. All right, why it matters. Obviously, access is not special treatment. These are practical and fiscally responsible policies. And as Michael mentioned, it's better for everyone. It's not just the individual that is neurodiverse, it's their entire family unit. And when we get to public spaces, we'll talk a lot about that and how our families feel excluded and why it's important to create spaces that welcome all of them. Next slide. All right, so Michael actually started doing this work before I got to the county. When I was a school board member and we were partnering with UM-NSU CARD, UM-NSU CARD partnered with the airport and did MIA Air. Michael, if you could tell us a little bit about MIA Air.
Sure. Yeah, it was really a great opportunity for us to begin, I think, this journey towards creating autism-friendly spaces in our community. The Miami International Airport was a very willing and receptive partner. They wanted to create an opportunity for individuals with developmental disabilities and their families to become familiar with navigating the airport. And so we created collaboratively with them the MIA Air project, which is really kind of an experiential project that allows families to visit the airport, go through security, visit an airplane, and get that experience before they actually have to travel. So it's kind of like a test, right? A run through of what it might be like to travel.
A dress rehearsal.
With a dress rehearsal, exactly. Good. And then, subsequent to that project starting there, the airport now then created 2 sensory friendly spaces in the airport, 2 sensory rooms in different concourses. So the airport's been wonderful. And of course, there's the Dandelion program and other things that they've developed since then.
Right.
Commissioner Regalado can talk more about that. But the starting point was creating this dress rehearsal, this experiential program for families to navigate the airport. And then the sensory spaces are remarkably impactful for a traveling family, just to have a place to kind of set their child, rent sensory system, regulate them, get them into a comfortable space. Because as everyone knows, airports can be really overwhelming. And if you have a sensory profile that is reactive to those kinds of situations, you can have a really difficult time in an airport situation. So congratulations to MIA for really leading the way, I think, with this program. And lots of other airports now across the country have done similar programming. But we were one of the first, and we're really proud to have been part of that.
So this is the 11th year of MIA Air, and we've actually augmented the participation significantly over the last 4 years. It used to be like once a year, and now we do it several times a year. As Michael mentioned, the airport also uses the Sunflower Lanyard, which is very easy. We've also incorporated this in transit. So this is just a way for people to know that you have an invisible disability, and we recommend it. If you come to our event on April 25th at Bethel, we'll give you one. If you go to the airport, we'll give you one. And we also work with TSA and TSA Cares at the airport. So next slide. Okay, so the next slide is the Miami-Dade model. So I brought a comprehensive item that, as you mentioned, was approved unanimously by the board, and it had UM-NSU CARD training all these different departments. We're going to talk a lot about public safety and the work that you've done there, but we started with libraries. You mentioned the 50 social stories I've included them in the toolkit. Miami-Dade libraries actually and UM-NSU CARD and the county got a national award from NACO for this work because when we talk about a social story, we took pictures of the actual libraries. And let's explain this a little, Michael, because whenever we talk about social stories, we always tell people that it has to be specific to the place, right? Can you
Yeah, I mean,
explain? Yeah.
a social story is really an instructional tool that helps learners with autism and other developmental disabilities kind of anticipate and prepare for an experience, and usually an experience that we anticipate there might be some difficulty with. So with the libraries, we created social stories that, and they're usually textual and also visual. Our learners with autism are generally very strong in terms of visual learning. So we always like to pair the narrative or the verbal parts of it, the textual parts of it, with a visual cue as well. So these are textual and visual stories that explain to the person with autism about going to the library and what will likely happen and what are some of the activities they can do. And we have pictures of the actual library. We did the same thing with parks as well, all of the parks across Dade County. But the libraries, and Ray Baker, who was leading libraries at the time, was such a phenomenal partner. His whole team really bought into, our aim here, which was to create these wonderful spaces for our family members who have children with autism to access the library. You can imagine if you're a parent of a child with autism, going to the library might seem like the
Like
last
the
thing you
third,
want
the
to
third
do.
ring of hell. It's like the
Right?
third ring of hell. Like if someone said, "Meet me at a library with your two autistic children," I would be like, "Why? I thought we were friends." So when we explain to folks that our families feel excluded from these public spaces, Ray really and his team embraced it very well, and they started with the stories, but we also have more sensory activities. There were certain libraries that were doing more than others, and then we also included sensory kits that are available at the libraries if anybody needs support.
Yeah, and some of the larger libraries have sensory friendly spaces like corners and areas where you can go and do a little like the sensory rooms in the airport. And then also they were doing sensory story times and on the weekends and creating just more opportunities for families to feel like this could be a place where I can take my child and people there might understand what they might experience with a child with autism. So super proud of that part of the program. And I think
And
it's easily replicable across really any community that has public spaces like libraries, right?
agree,
With
and
the
that's
right
a
partners.
yeah. So the next part of that was training as infrastructure. Obviously, you were our expert partner. And we also wanted to focus on adults and not just children. And then we did have a feedback loop, and we'll talk about that. But this idea of training as infrastructure, let's talk a little bit about that because that was one of the things that we really emphasized on. And you guys did a great job of explaining de-escalation and basic interactions, right? Because one of the things we talk about is government workers are the first contact with families, and neurodivergent individuals. And that interaction could either be a positive one or a negative one. What should people know about that training and why it's so important?
I think it's really all about teaching, as many people who are going to have interactions with individuals with autism, what autism actually is, what autism actually looks like, what a social partner with a person with autism might actually experience. So the first thing for us is always about autism recognition, right? Understanding what it is you're seeing, because that could be misinterpreted a lot. And we spend a lot of time when we're doing our law enforcement training talking about how do you recognize that this person that you've come across might have autism or a related disability. And then, of course, we teach people, the kind of how to's, the ABCs of how to interact with someone, about their sensory sensitivities, about how to approach them, how not to approach them, about just understanding the framework within which they interact with the world. Because I think it's just important that we understand the people that we're interacting with, particularly if those people are neurodiverse or approaching, the world in a different way or understanding the world in a different way. So it's about giving people the tools to interpret and understand and then know how to respond to the individual with neurodiversity.
Agree. Next slide, Alejandro. All right, so here we go. Let's get into the meat of it.
Quite a lot of meat.
Yes, that's a lot of humans. The training of our police officers. And you and I talked about this when we first, envisioned the item. And we'll say we trained, I think, about 2,000, and then you did a report, and then we came out with the decal. I really didn't want to do the decal until we had trained enough police officers to give people credibility for the decal. So, let's talk about the training, but I will say the decal is important. It comes with a registration. You helped us create the registration also, and it has a lot of information that caregivers can put in terms of that particular individual and de-escalation. And now that the sheriff is independent, they're changing how the decal looks to add the sheriff's logo. And they've added car registrations this April. So now you can register your home, but you can also register your car so that officers are aware that a neurodivergent person may be in the vehicle or may be in the home. Can you tell us about how you did the in-person training for police
Sure.
and fire?
Yeah, I mean, I think this whole presentation is ultimately about collaboration and teamwork. Like, no one can do this alone. No municipality can do this alone. It really is about accessing, those partners who are trusted partners in delivering not only the training, but also sharing the vision for what we're trying to ultimately accomplish here. So we're in a very interesting position as the CARD Center, because CARD is funded to provide training and also provide this public education and awareness. We can't do what we did for the county with just the funding, obviously, we get from the state, because we have other priority areas to attend to, but we are very successful in the philanthropic space, and also in getting support from the county to expand the project. So we were able to onboard a very trusted colleague who's an expert in autism recognition and response training. His name is Bart Barda, runs a company called Autism Safety 101, was a former client of our CARD, was a former board member of our CARD, was a former officer in the Coral Gables Police Department. So he has a lot of credibility in the autism safety space. And so with the funding that we were able to pull together from the various funding sources, we were able to onboard him as a consultant to provide these trainings. So we've worked extensively with Miami-Dade Fire Rescue. We worked extensively with the police department and the sheriff's office now. And to date, as of March 31st, we've trained as part of this project over 4,000 first responders in Miami-Dade County. And we've trained other folks throughout our region. Our CARD region is Broward, Dade, and Monroe, but we got funding from a private donor to allow us to expand that training even beyond our region. So there have been other trainings throughout the state of Florida and other regions with Mr. Barter. And so we're very happy. I mean, probably in total, we've trained well over 5,000 first responders, just our project alone. And some other folks throughout the state of Florida do this kind of work as well. But we really appreciate the partnership with the commissioner and the county and Mr. Barta and all of these 4,000 first responders who show up and willingly learn and try to enhance their skills, so that when we encounter someone in the community who has a neurodiversity like autism, they feel better prepared to make those interactions and to navigate those situations.
In terms of how, I mean, I attended some of the trainings, and folks volunteered, right? They show up, they're physically there, and they also get to meet adults in the spectrum. Because I think there is a difference between the littles. I love me the littles, right? But I love me the littles. They're so important for people, to recognize autism with the littles. But it's with the adults, specifically the adult males, where we see issues with more arrests and more Baker Acts, just because people misinterpret, right? A lot of the things that they do when they get anxious, and they consider whether it's stimming or raising their voices or not taking off their headphones, right? They consider all those signs of aggression when they're really just signs of attempted self-regulation.
Mm-hmm. Yeah, I mean, for us, it was always very important to have not just the didactic component of the training, but the experiential component of the training. And we happen to have several adults with autism who work here at the CARD Center. And one in particular has been very active in participating in the training because he's had firsthand experience interacting with first responders that didn't understand that he had autism. And the way that he was presenting was consistent with his autism and not interpreted another way. And in fact, sometimes he's reported to us that he was pulled over, or they thought he might be drunk because his speech might have been slurred, or he might have been anxious in the way that he was responding to the questions. So, just again, creating providing not only the information and the training through a didactic course, but also having them meet this individual and interact with this individual and hear firsthand the kinds of experiences that he had in the community with first responders. And I think that's probably really the most transformative experience that these individuals have, because they suddenly have like a template for what
have a reference point.
and a reference point for what this might actually look like out in the community. And then they're primed to respond differently now because of that experience, which I think is so important.
Right. Yeah. No, 100%. And I think that it's changed not only the view of disability, but of responses and interactions with the family members and with the adults. And I think to hear it from their perspective, how they see the interaction is very important. Now, the other thing that we made sure to include when we did the decal is that, some of the members of our community may not be verbal or may have limited, abilities to express themselves. And that's also like a component of the training. When we talk about the training for the firefighters who are responding, that's a little bit different, but also we found a lot of firefighters that said that even though they knew a little bit about it, how to de-escalate and how to interpret if a person is in crisis, whether they're responding to a medical issue that person is having or that person's caregiver. We had a lot of cases where they were responding to a caregiver, and an autistic individual that was an adult, was having a response to fire being there.
Mm. I also want to say something, if I may,
Of course.
that there are many people with autism and related disabilities who are speaking or who are verbal. We do have non-speaking people as well, but even those who do speak and have the verbal capacity to communicate with words often can't use or find those words in a stressful situation. So I think I always say that the most underdiagnosed symptom in autism is anxiety. And I think fundamentally, in many ways, it's an anxiety disorder. And in stressful situations where you're encountering first responders,
they shut down.
They might shut down. In fact, many of them do shut down. And I think that can be misinterpreted as well. It could be seen as noncompliance or defensiveness or, complicitness in something that occurred. So I think it's important that, this is part of the training, right? To understand that even someone who's able to communicate might not be able to in a certain situation. And I think that's important for first responders to understand, because when you encounter someone as a first responder, it's usually a stressful situation, right? You're not just incidentally encountering someone like to say hello, right? Usually there's something that's triggered the interaction. So we just have to be, it's all about contextualizing that experience for the first responder.
And I'm glad that you mentioned that, because the other thing that we try to explain to folks is that this training is important because if an individual that is neurodiverse has a negative interaction with a first responder, when they need a first responder later, right, they might not go to the first responder, right? So we have cases of individuals that have had a negative interaction, and then every time they see a first responder, it triggers, right, the feelings that they felt when they had that negative interaction.
I think that's so true. And that's why you're starting to see more and more throughout communities that they're creating more positive opportunities, like a day in the park with first responders, and people can interact and it's more social. Every time we do a family picnic for CARD, we always invite the first responders. We invite the police dogs, we invite the fire and police, and those kinds of interactions, those community-based, community-facing friendly interactions, I think create an opportunity for folks to really understand the positive aspect of those people and those interactions and the role they serve in protecting and keeping our communities secure.
And the last thing before we move on to the other pieces of the toolkit that's important with the training is, for a lot of our families, when you and I talk to them about job opportunities, about using transit, about independence, one of the issues that are raised are interactions with first responders. So also, people need to feel confident right? That when the individual that they love is out there in the wild, that there are humans who understand, right?
Right.
That
Yeah.
interaction.
I mean, we've had so many incidents. I mean, one of the reasons we've devoted so much effort and energy and money and time is because we've had incidents over the years where a family has been out, either the individual has been out on their own or they've been out with a family member and there's a meltdown or a behavioral, situation that occurs, and law enforcement either are there and witness it or they're called to the scene and then have a difficult time understanding it. And some those situations can be very problematic in terms of how they kind of get sorted out. And so we just want to, the more we can train this autism recognition and response training, I think the more opportunities people have to have positive experiences in the community. We want everyone to just know and understand better what a person with autism is experiencing in the world and what a family of a loved one with autism and related disability is experiencing as they navigate the world. It can feel like a very lonely path out there in our community for a lot of our families. And so this is why many of our families only interact with other families who have people
Right.
with autism in their families because it can feel so isolating. And so we're just again, building community through strategic partnerships and hopefully creating safer places and spaces and making it easier for families to access and navigate the world around
Right.
them. Yeah.
And again, I think, we're tracking the data because I think we will find with the training less Baker Acts, less unnecessary arrests, right? Less of that, and also better relationships so that people feel safer and more connected. All right, Ali, next slide. All right, sensory spaces and inclusive events. One of the examples that I used, Michael, was the youth fair, just because we've done it over several years. And I think one of the barriers is that folks feel like they have to do everything all at once. And that's not the case. They can start somewhere is my motto, right? Just start. I tell folks the motto at my house is we didn't come this far to only come this far, right? So we're constantly, with the next thing. But I mentioned in the toolkit a mobile sensory room that we did with Loud and Live that they used at outdoor events, which I think are very important because a lot of our families just cannot attend outdoor events. Like that's just a non-starter for them. And that has made a lot of those events more accessible. But I think the youth fair from a like statewide perspective is such a great example. You started with them doing the sensory room and the social stories. That was like year one.
Yeah, I mean, I think you're saying you said it perfectly. Like you can't, you shouldn't, and you can't do everything all at once. It's just not feasible. No one has the resources to. I don't have the staff to deploy to tackle everything that we wanted to tackle with this project. So yes, pick the priority areas, start there, and build. Just outward as you have success and as you start to build the buy-in from the broader community. We've done autism-friendly partnerships with other municipalities throughout South Florida. Miramar is the most recent, but also Cooper City and Weston and Parkland and others. And those are very labor intensive initiatives. Obviously, you can imagine how big the county initiative was, which is why it's taken us, as many years as it has. But you have to start somewhere because you want to also have success right out of the gate. Because if you don't have success right out of the gate in your community, it compromises everything you hope to do going forward. So we were very successful at launching some of these initial kind of easy things to check off: the youth fair, the sensory room, the social stories. Once we got to libraries, I mean, that was a much bigger initiative just because there are 50 libraries, a lot of staff, and a lot of opportunities to create change. And then from there, we just continued to, and we still have more work to do. We're presenting this today, but it's not a finished product. We still have more first
No.
responders to train. We still have to make sure that the places that we've designated autism friendly continue to be autism friendly. So one of the parts of our program is to continue to periodically go back and check or get feedback from our constituents to make sure the experiences that they're having align with the experiences we intended them to have. So it's all very iterative, and it requires
Right.
constant attention.
Right. So the second year for the youth fair, what we did is we found sensory friendly locations and we gave folks that information on the map. I had talked to the youth fair about how I actually go the opposite way, like IKEA. You know how everybody goes one way down the youth fair path? I go like the other way because it's more sensory friendly. And then this year we did sensory hours. So we turned off the lights, we turned off the music Saturdays and Sundays from 12 to 3. And we had so many parents go out for that period of time, even though it's a little hot, but you have less people. And they felt like it was a more controlled environment when the sensory variable was the rides, as opposed to the rides, the music, the lights. It was just, it's a lot going on. It can all feel very overwhelming. And similar to what happened at the Loud and Live events, we even had a lot of feedback from neurotypical people who said, you know what, I'm for that. Like, just turn everything down a little bit. It's a little much. Can you tell us about your autism-friendly initiative with museums? Because I know you've done a lot of
Yeah,
museums.
actually, that's exactly what I was thinking about. I think, and it's so important that you have a whole slide here devoted to the sensory experience, because that's really what makes or breaks whether or not an experience is positive or negative, right? So, we worked with a bunch of museums now throughout South Florida. Everything from History Miami to Young at Art to Super Blue to Frost. And for some of those, one of the things we targeted the sensory experience for all of them, but in some cases we created tools like a sensory map so that parents could anticipate, or people with autism who were there on their own could anticipate, as they turned a corner, what kind of sensory experience in the museum were they going to have? Is it going to be bright light? Is it going to be noisy? Is it going to be a little bit colder? Because the sense, if you can anticipate an experience like that, then you can adapt more readily to what's coming. And so, we're very proud of all those museum partnerships because, again, museums were often places that a lot of our families would tell us that they didn't, even if they did access them, it wasn't a positive experience, or they never even tried because they anticipated it would not be a positive experience. So I think it's the other thing I'll say is, like, attending to these kinds of issues is good for business. It's
Yes,
good for the bottom line to be more inclusive, to create more opportunities for a broader audience. So we're very proud, and I think we've been very successful. And some of our partners are, extraordinary in what they've done to make their facilities more inclusive.
agree. All right, next slide, Ali. All right. So April, we started raising the flag. Shout out to Crystal Academy for doing it in Coral Gables. As we mentioned, Coral Gables was really the first municipality to really start doing this work. Craig Lean, Brad, like there were a lot of people a long time ago when no one was talking about autism that started doing this work. So far, we have 26 new municipalities and counting. So it's been really great. In terms of the flag, Michael, I think that just having this conversation, I know that we all get a little overwhelmed in April, but I think it's really gotten our families excited seeing that their municipal governments are interested in doing this, right? Like it's sending a very good message.
Well, first, shout out to Mari Palacio at Crystal Academy for imagining this and all the people who've supported this venture, I think, along the way. I mean, to see it expand this year has been really gratifying. And I think it is, I mean, it's a cliche, right? But representation, matters for the disability community. We want to be seen, we want to be heard, we want to be part of the conversation, and I think the visibility of that kind of symbolism, for the disability community is really meaningful. And to have municipalities join in and support autism related disabilities, April is a challenging month for a lot of us. It's extraordinarily busy. It's a reminder for those of us who live in this and work in this space every day that we need to remind other people that there are a lot of other months where autism is still present, and we can't just do everything in April. But it is a moment to just stop and reflect and celebrate the things that we've accomplished, but also reimagine the things that maybe aren't working so well, or come up with ways to move forward to do more inclusionary activities, and create a society and a community that allows families to participate more actively and more openly in everything that's available to everybody else. So So I'm very, I'm a mixed bag when it comes to April. I think there's
Same.
a lot of good, but it's also it can be a little frustrating that the other 11 months don't get the same attention. But
Yes,
we're doing
yes.
our part. That's
Right.
the whole part of this project is to make sure it's a year round, 365 days a year venture. Like our families live with autism every day, not just
Every day. Agree. Well, I added in the toolkit as an opportunity, April and October, to really look at what your community has done. So beyond the picture, like what has your community done, and use it as a goal setting. And when I've been talking to different municipalities about doing this work, like what is your plan for October? What are you doing for next April, right? How are you going to move the needle, right? What did you do this year? What are you doing next year? Because I think all of this builds. And if people are cognizant of that, April and October give them something to build towards, right? Because we're constantly all being bombarded with stuff, but this gives us like, okay, by October we're going to do something for employment. By April, we're gonna have some accountability. So I think that that's how we should kind of frame it, as an accountability opportunity. Ale, next slide. All right, employment and workforce access. This is in the toolkit. Obviously, I mentioned KLA and a few other things, but Michael, I wanted to ask you about registering with CARD, because you do a lot of support groups. You do support groups for parents, for moms, for dads, for grandparents, for siblings, but you also do some basic employment training that I
Yes.
think is very worthwhile. If you could tell us about that.
Yeah, I think you're right. We have a support group for anyone that might have an interest in getting support from an agency like CARD, including for families of adults, for fathers, for mothers, for grandparents. We have sibling groups. We have groups for families who have children with more profound autism. We also have a group for teachers, a support group for teachers called Teachers Chat, where they can come and just share and learn and be supported by their colleagues. But yeah, employment's been a major focus of ours over the last, I don't know, decade or more, maybe more, when we've had a lot of wonderful funding partners that have supported some of our transition to adulthood initiatives. So we've been spending a lot of our effort on creating pre-employment training programs. We have a program called Job Seekers, which is really for individuals who are job seeking but need support with resume building, with interview skills, with understanding how to dress appropriately for the interview, or how to behave not appropriately, but how to be good employees once they get the job, right? And we also have a job club for people who are job seeking, so that they can get support from each other while they're going through the process of trying to find employment. But the Job Seekers program has been very, very successful at preparing young adults for employment. We've also then extended that to creating really important partnerships with foundations like the Des Moines Foundation, which provide the support in employment. So folks who come through our Job Seekers program can then get the support from another organization in the community, which can then create sustained employment for them. And then now we're going backwards a little bit and focusing on those teens who are transitioning to adulthood and doing more with self-determination and just really trying to support them more as they prepare for life after school, whether that's college or employment or trade school, whatever it is, but starting earlier and earlier in the process, really at the age of 12, which is when transition planning should begin. So we've got the whole spectrum covered. I think the beauty of working, collaboratively is CARD is a lifespan program. So we can follow clients from the time they're diagnosed, usually at 18 months to 3 years of age, all the way to adulthood. I've been here 30 years. I have a bunch of clients that I've had for the full 30 years that are well into their 30s now. So having that ability to be a touchstone for people throughout all the different transitions in life, I think is really one of the most special aspects of what Florida created in the CARD program 33 years ago.
Well, I will tell you, I think obviously October is when we focus on employment, but at our Inclusive Family Fun Day on April 25th, we're going to have a lot of adult programs. We're going to have Lily DeMoya there also, but we're going to have a lot of these adult programmings that are doing vocational training. Obviously, CARD is going to be there just so that parents start early. I'm glad you said 12, because that's what I tell folks, and they look at me like I just grew a third head. But at 12, you need to start planning. You need to start planning. You need to start figuring out, right? What is the next
I
step?
mean, It begins, I mean, that's the formal age when we start transition planning, but really those conversations have to happen even earlier. Like, even for a young child, what are the interests that that child has that you can
Yes.
cultivate into a skill or to a vocation? And I think I also want to just put a plug in, just because we have an audience here that is a potential partner, is that one of the challenges we have is that we don't have enough employers willing to create opportunities for individuals with autism who are looking for work. So anyone who's out there, whether you're part of a municipality or a business, or you have a family member who has a business, like, we're looking for opportunities to create more jobs in South Florida. So we welcome those conversations.
Right. And one of the things that we found in the training that you've done in the county is that that's also opened up opportunities. So, for example, we have more folks volunteering at libraries, right? Because now the library staff is trained, so they feel comfortable, you know?
Yeah, and
Um,
a lot of our autism-friendly partners have created
yes,
employment opportunities. So some of the museums, for example, and some
yes,
of the municipalities, it's been really wonderful to have to kind of close the loop. Like, you create an autism-friendly partnership,
right.
and then they create job opportunities that support and sustain employment for these individuals that we care so much about and want just full lives for. I always say we want them to have enviable lives, not just good lives. We want them to have a life that anyone would look at and say, that's a great life. That's a life that I would want for myself or my child. So we have.
Yes. And they're wonderful workers. They're committed. They never want to leave their job. At the county, when we did the internship with KLA, they wanted to work on Labor Day and Memorial Day. They don't understand why they can't go to work that day. It really is, employment is such a large part of being an adult. And for them, that is a necessary step. So I think parents need to start understanding that some level of employment is really also very good for their mental health.
Well,
So
I mean, as we know, you and I, work brings value to our lives. It's not only the value we bring, but it's bringing value to us. I have a young man that's been working for us, relatively minimally verbal, who's been coming here for years, only 2 hours a week with a personal care assistant, to do one job, which is to shred documents. And during COVID, he would wake up every Wednesday morning and say, "Go to UM, go to UM," and his mom had to tell him, "You can't. We're not going to work today." It was very much an important part of his life and continues to be. So I think we just need to remember that work is an aspect of life that brings meaning and value to the person who's doing it.
agree. All right, Ale, next slide. All right. So government services, I'll just go quickly through this because we've covered some of this, but we did neuro-inclusive days with the tax collector. We brought in all the constitutional officers. So we had elections, the clerk, the property appraiser, obviously the sheriff's office. IDs are so important, and we want to give thanks to the tax collector who made it easier for us to get those IDs. The tax collector's office is actually going to be physically at our April 25th event, our Neuro-Inclusive Family Day. So if you don't have your ID, you can come get your ID at that event. And this has been important because now the state of Florida, and Michael, you and I fought, we tried to get this done 10 years ago, but now the state will allow you to voluntarily put your disability on your ID card. So life-changing stuff, because that ID card is then legal proof of that disability, right? You don't have to explain it. You and I have seen it, a 25-year-old with a parent that's walking around with a birth certificate and a diagnosis from when they were 8, right? That just doesn't make any sense, especially when you're trying to get them a job, an ID really is the first step in so many different things.
It's so important. And so many of these neurodiversities are really hidden disabilities. It's not like you can
Yes.
obviously see that the person has a disability. So having this form of this way of communicating that to other people is really important, I think, in our community.
Agree. Next slide.
I also just
All
want to
right.
comment on the last slide really quickly, which
Yeah.
is, in terms of Jackson, Jackson
Oh,
Health
yes.
has been one of our great healthcare partners. They were the first, I think, probably in the nation to have autism-friendly urgent care centers. All 5 urgent cares at Jackson are autism-friendly, and also their pediatric emergency department. So that partnership has been extraordinary. And Nicholas Children's as well partnered with us, and they are also an autism-friendly hospital healthcare facility. So wonderful, wonderful partners.
Yeah, I mentioned Jackson in the toolkit just because they were one of the first. And especially at the emergency room, it's so important because again, high stress, right? It's like the healthcare version of the airport, just high
Right.
stress environment, right? You know, difficult. Everyone is at their wits' end. It's so important to go confident that the person who is going to be helping you understands, has that training and understands de-escalation and might, understands that you want to turn off the lights, and that they have to wear headphones. All those things can make that experience so
Mhm.
much better. And, obviously, healthcare is one of the big complaints that we get about parents. So the more and more folks that could do this training in the area of healthcare, I think would really transform the lives of our families.
Yeah.
So this
We
is a
also we also just wrapped up the Walgreens clinics as well as an autism-friendly partner, which is just wonderful extension of that work.
nice, nice, yeah. So this is the toolkit at a glance. Like I said, you can get you can go on the website and you can see it. I'm presenting it to different municipalities and to different counties throughout the state, but I want to give everybody a few minutes for like the Q&A. And then the next slide, I think is just like the what you do now, which I think I already mentioned. Ale, next slide. Right. So I already said it. You don't need a consultant. You need to call Michael, but you don't need to like hire a bunch of people. Michael's got people.
Well,
Michael's got
yeah.
people that could do
Not
the work.
enough though, not enough. We need
Not
more.
enough. Yeah, yeah, yeah. And again, like I've said over and over to our municipal partners and parents who just need to start, I will say the other thing that's in the toolkit that's very important is creating spaces for parents to communicate with government. So whether you want a task force or a freestanding disability committee, Coral Gables has one. I've actually helped my municipalities create them. Some folks can do that long term, but maybe you just want to have a task force. The reason that I mention that as an important step is because you don't, who has access to policymakers can change. And sometimes folks need a particular thing. But if you get all the parents and all the stakeholders in a room, you can land on better solutions and prioritize as opposed to do the one thing that the person with the most access wants, which may or may not be what your community needs. And also, we don't want to duplicate things, right? So if there's something in the municipality next door, right, and you guys can share that asset, right? Then it might be a better use of resources. So with that, I wanted to see Alejandro if there were any questions. I know that Michael's been answering some of them, but we wanted to give people an
There are a few
opportunity.
in the chat, and yes, Stephanie commented that Doral has a disability committee, and also Key Biscayne
Key
now, and
Biscayne now
Miami
has one, South
Lakes, Coral
Miami.
Gables, South. Yeah,
For
we're seeing more and more, which is wonderful.
yes,
Um,
Miami Lakes has one.
our friend Crystal wants to know where can she go to pick up the decal.
So the decal you have to
She
write.
signed up but hasn't gotten one yet, so she just wants some information about that.
Okay, so the sheriff's office has the pickup locations. I think it's like the certain headquarters, definitely the headquarters in Doral. You can get it. But if you go to our Inclusive Family Day, we will have them there, and the sheriff's office will be there. So that's probably the easiest one. But we'll add the locations. I think there's like 3 locations where you can pick them up.
Okay, and then Crystal, again, what's the minimum age for the Florida ID?
5 years old.
5 years old. Okay, very good. Uh, and then Cecilia Fernandez, hi. How can we as parents participate in these initiatives to support you? So yeah, for sure, if you're interested in learning more about what we're doing, either at the county level or in any of the local municipalities, you can reach out to me, and I can let you know ways in which families can participate. We do try to get as many families as we can to uh, try out some of the venues that we've worked with to be autism friendly
Right.
and to give us feedback, but also to be, liaisons to new communities where maybe we haven't done a partnership yet. So all of that, I think, is a potential partnership for you. So hi. When and where is the Inclusion Family Day?
It's at Temple Beth Am, April 25th.
Very good. That's the
Yes.
last one I have
And
here.
we're going to have a lot of resources pretty much this year. We're going all out. We're going to have a lot of things for the kids and the adults to do, but we've also partnered with Autism Speaks. They're having their summit right next door, so you'll be able to see that. We're going to have police, fire, libraries, sheriff, and then we're also going to have a lot of adults. Providers that are participating, CARD's going to be there. And the idea is everything that I wish someone would put in one place 10 years ago, I put in one place. Uh,
There's also the other thing I just remembered. I was looking it up on my phone. May 13th, the Key Biscayne is bringing together a lot of these disability committees from
yes,
other municipalities. The commissioner will be there. I'll be there.
yes.
So hopefully more information will go out about that at some point. But I think it's important that we keep learning from each other. And I think those opportunities to bring everyone together are super important. And I think my takeaway message is, there are wonderful willing partners throughout every community. You don't need to reinvent the wheel. Find your partner,
Yes,
find your person, your autism person, as we say in this world, and kind of,
yes.
run with your initiatives. You can't do everything all at once. Like some of us our bandwidth is limited. We do as much as we do more than we can really, but we want to do more, and we'll find ways to accomplish that. And anything the commissioner asks of me, I always do.
Thank you. Thank you. Thank you. But the for the toolkit, I made the toolkit so that everyone can access it. So if you go on the website, www neuro-inclusion-toolkit.com, you're going to see all the sections. And in the appendix, you're going to see all the legislation and everything. And if you want to take some of this to your elected official, please do. I'm visiting all the municipalities. I'm taking it on a road trip. But obviously, the more people that talk about this, the better. The more people that focus in on it, the better. I've had a lot of municipalities ask me for different things when I've gone before them. Every time I go before a commission, they focus on one or two things, and I'm happy to help them with that. But we really need parents to start speaking up and to talk about these needs, right? Because we are a disability community and we need to advocate as one. We need to, give everyone like a shout out for, doing the training and doing the good stuff, but we also, need to push them towards doing more. So, Michael, I love you so much. Thank you,
Love you
thank you,
too.
thank you.
Thanks,
And
Raquel.
obviously, the first thing that you should do when you get a diagnosis is register your children with UM-NSU CARD. If you haven't done that, please do that. Yeah, they have a wonderful email blast. You'll find out everything that's going on. And I'm going to be actually, I'm a little behind, but I will be also launching an email that has a bunch of a website that has a bunch of stuff that people can use. But I really think that we're at a time where there are some people that are trying to monetize, right, our issues, and I don't want government to get like sucked into that because, like Michael said, we've already done it. We've already proved the concept. It's already here. We literally want you to copy us. We literally are like, please copy what we're doing. We just need more people to do it. And that's what this toolkit is about. And I think Florida has a tremendous opportunity to lead because it already has the cards and it already has existing infrastructure. And, the good thing is, Michael mentioned it, we are constantly checking in to make sure that these things are working. And we need to keep doing that too, because it keeps changing, right? It's not just like one and done. It is a process, but in the same way that we create things, we also need parents and caregivers to participate in those things, right? So if we do sensory hours, we need you to go to those sensory hours, right? To prove the concept that this works. If you are going somewhere, choose an autism friendly, place that has that designation. And when you go there, tell them, I'm here because you have the designation, right? We need to speak up and tell people that this is why we are frequenting those places and that we're grateful. So that's how we get a little bit more momentum. All right, everyone. Thank you, Michael. You're wonderful. Thank you for
Thanks,
everyone
guys.
that attended. Have a wonderful day.